We've talked quite a bit over the years on 8 West about bariatric surgery. Our experts at St. Mary's Healthcare are a great educational tool for people considering the surgery.
But one question many people have is about whether it's going to be covered by their insurance company. So today we asked Dr. Paul Kemeter, the medical director of the program, to come in along with Kim Harkis, a billing supervisor, to help us answer these questions. Thank you both very much for being here.
Good morning.
And I suppose a good place to start is with that question. What insurance companies are going to cover bariatric surgery?
Most insurance companies do cover bariatric surgery now. It's just a matter if they meet the criteria or if their employer chose a plan that does cover bariatric surgery. But your major carriers, Medicare, Blue Cross, Priority Health, they all do cover it if it's a benefit in their plan.
That's really good to hear. Do you think there is a misconception out there, Dr. Kemeter, that this is not something that would be covered by insurance?
Oh, absolutely. And, you know, I think patients in general, that's one of the reasons why they're not seeking out the care that they need. And we've talked over many of the programs about how dangerous obesity is and the comorbidities, the high blood pressure, diabetes, and sleep apnea. And we have a treatment. It's called bariatric surgery that can help with that. But patients, I think, because of that misconception, don't come looking for the help that we can provide them.
That's nice.
And was there a time when some of the insurance companies didn't cover this as something that is newer?
There was. Many years ago, it was real difficult to get it covered by insurance companies. Some of the insurance companies would put criteria in place that was almost impossible for patients to meet. You know, like there was one insurance company that had a 2-year weight loss attempt that a patient had to do, and there was just no way for a patient to be on a diet for 2 years straight. It's just impossible. And
yeah, so what kind of questions should people ask their insurance providers if they're interested in this?
Well, first of all, they need to ask the insurance company if they actually have coverage for bariatric surgery. And then if they do, what type of surgeries will it cover? Not all insurances will cover all of the procedures that we do. The newer one, the sleeve, is not covered yet by all insurances. Most insurances it is, but there are a few out there yet that don't. Then they need to know if there's a weight loss requirement. Do they have to have done some type of medically supervised weight loss prior to bariatric? Some insurance companies have a requirement anywhere from 3 months to 12 months of weight loss attempts. There are more that don't have that, but there still are quite a few that do. Then they're going to want to know what their co-pays are, if they have co-insurance, if they've met their deductible, and if not, how much is still owing on their deductible.
Yeah, those are all really important.
Yeah, a lot of things you want to consider, and you did mention the perhaps time frame that an insurance company might have for attempting to get that covered from their insurance company, but what are some of the other requirements that an insurance company would have?
Those are basically it. They do have to have a psych eval, and we do have that right at our office. We have someone on staff that does that, and then they have a few appointments that they go through before they have surgery, and the insurance companies need to see the documentation from those appointments too.
Of course, you need to see criteria and make sure that everybody fits this. Now is a really good time to seek out this kind of treatment if people have been thinking about it, not waiting perhaps until the end of the year. Why is it really important to start thinking ahead, Dr. Kemeter?
Come November and December, we get inundated with patients coming in with the thought, I've already met my copays, all my deductibles are there, I'm ready to have surgery and I want it done by December 31st. And realize that this is a 3 to 4 month process to get through everything that needs to take place before we can actually do surgery. Some patients can fly through a lot quicker than that, but some patients, it can really take up to, again, based on the insurance, up to a year. So if patients are thinking, I want to get it done by the end of this year, now is the time to start acting. Not thinking about it, but actually acting, because if you wait until November and December, we pretty much have probably already filled most of those slots. And so now's the time to start making phone calls and getting the appointments made that need to be completed.
Okay, now what if by chance your insurance company does deny coverage or doesn't provide the amount that somebody thought they may or should? What are some other options? Are there other options?
Well, if the insurance company denies it, we will go through an appeal process with the insurance company. They'll send us a letter. We'll find out exactly what it is that they felt the patient didn't meet and try to get that documentation. If the patient doesn't quite have the documentation, we'll work with them to figure out exactly what they have to do yet. Sometimes patients have done weight loss, but maybe they're missing, a month or something, and sometimes they just need to finish that up.
Right.
So we will work with them and their insurance company, and we've even had to have our doctors, they'll call and do a conference with the medical director over the phone.
That's good to know. It really
to
is.
try to work with them to get this covered.
Right.
So it doesn't always mean we can succeed. Sometimes we just don't, and the patient does have that final option where they can try to work with the insurance company and even do a face-to-face appeal with them.
You have a couple seminars actually coming up where might prompt people to act right now and kind of get that information they need. Can you tell us about that? The first one's on the 10th of September.
Yeah, the first step that we have every patient do is come through one of our informational seminars, and we go through every surgery that we offer, and that gives them an opportunity to really hear about the pros and cons of each surgery and decide, do I really want to go forward with this? And it's a free seminar. It's worth the hour. I talk a little bit more at my seminar, so it's an hour to 2 hours. But usually we try to get done in about an hour and 15 minutes, so it doesn't take up a whole evening.
Yeah, on the 10th and on the 14th, a couple opportunities to come in. Well, thank you so much. I know the insurance component of this is really, really important to a lot of people, and sometimes the thing that keeps people from acting when they really want to do something. So we appreciate you coming in today.
All right, well, thank you so very much for having us.
Yeah,
Thank
we'll
you.
be right back.
Are you West?